In addition, Amy has something that she wanted to get started with right from the get-go. So Amy?
Hello everyone, I am in charge of moving day. So I'm a big mover and a shaker, and I am in charge of the moving day in Buffalo, Rochester, and it used to be in Syracuse, but we've changed it. It is now Finger Lakes to try to get more of the other region and the other areas, so it's going to be Ithaca. So is anyone here that would be able to go to Ithaca? If you could raise your hand. Perfect. Or if you know anyone out in that region. So I'm going to be talking about the Ithaca Walk today, but I'm also going to be talking about other things that are going to be coming for the Rochester Walk. What I'm going to pass out now is a form that you can fill out for either, and you can circle if it's Rochester or the Finger Lakes. Instead of you having to fill out to join, I can do it for you. Because sometimes it's just easier, and then you'll get an email once to know that you registered, and it's all easy and done, and then we can go from there. So if you would like a form for the Rochester or Ithaca, you just fill it out, and if anyone would like to be part of Moving Day, and then I will talk about Moving Day after Nancy's presentation. So I'm going to pass these out for anyone that would like one. I also have the flyer for the Finger Lakes one, and you can register yourself with the barcode. And I'll come again before the Rochester event, and we can kind of go over Rochester one more time and see if anyone wants to register again for that. But I'll let Nancy do her presentation, and if anyone would like to, I'll walk around and see if anyone would like a registration form.
Great, thanks, Amy. So I'm called the Senior Education and Program Manager, and I started working with the Parkinson's community in Rochester in 2014. And my role has changed and been various things over the years. And one of the things I realized is that the Parkinson's Foundation today is very, very different from even the two organizations that it became from a merger. And folks really don't know all that we do because you just might not see it. The incredible work that you have happening here in this community and the support of people with Parkinson's is so incredibly impressive. So with that, I want you to know what's happening on your behalf on a national and regional level as well. So the Parkinson's Foundation is exactly as you might expect from the mission. Whoops, need to change the slide first. We exist to support people living with Parkinson's today in all that is happening. And there are really three pillars that we build our mission on. But there are over 1 million people in the United States with Parkinson's. And we know, Dr. Gilman was just saying it a minute ago, it is an epidemic. It continues to grow more and more. But we have so many resources in addition to what has been mentioned already, which is phenomenal. I love all that you just talked about. And John Paul's legacy is just tremendous. But there's so much more happening. So with that, as you know, there are a lot of people being diagnosed with Parkinson's. If you had looked at our website last year, 9 months ago, you would have found that 60,000 new people were diagnosed each year. However, we had a study done with Medicare data to know that, it's not 60,000 new people every year. It's now 90,000 people are being diagnosed every year. That's just astonishing, and we need to do more and more beyond what we're even doing now. Second most common neurodegenerative disease after Alzheimer's, and because we're all aging, as we grow older and older, the risk of being diagnosed with Parkinson's grows as well. And we know we have that gray wave, the aging baby boomers happening, and that's certainly contributing to it. So I mentioned a minute ago that we build all of our work around these three pillars. And it's also broken up into kind of a timeline, let's say. So for today, Parkinson's Foundation does a lot of research. I don't think many people know that we do a lot of TB research. And then in addition to that, the second pillar is to improve care. You all probably know that in Rochester, there's a movement disorder clinic. There's one in Albany. There is a great center, a couple centers in Buffalo. But you probably also know that for people in Binghamton, Elmira, further in the southern tier, they've got to travel miles to get specific Parkinson's care. So that is a big, big, big part of our mission, is to improve care, because we know people do best when they are seen by a movement disorder specialist. Next, a neurologist, of course, but we also know throughout the country there are people who never see a neurologist at all. So that's something that's very much on our radar that we are working towards. And I'll tell you a little bit more about that in just a minute. And then the last part, this is really where I come in terms of my role, is to work with the Parkinson's community. And we do so much education, so much training, professional education, just goes on and on. We just can't slow down because there are just too many people who need all of this service and more. So let me move on, tell you a little bit more about the heading under for today, for tomorrow, for research. So we do want to accelerate towards the cure, find the research. The Parkinson's Foundation research is not only this, but it's centered on basic science research. We are funding the brightest minds to figure out why is it that dopamine production slows down near stops. The science behind that can unlock what we need to do to fix it. We want to know, why does this happen? So you might think, well, research, so you think of the Fox Foundation, they do incredible work. So they're focused on funding a lot of drug treatment trials. They want to find those drugs, which is great too. So we all have in the world here specific tracks that we're all working on in terms of research towards ending Parkinson's disease. So we have a couple interesting things that are happening as well. So just so you know, since the foundation started, we've funded more than $449 million in groundbreaking research. We're part of a lot of national and global efforts as well, but it is paramount to us that research is core to our existence, and we want to continue to do more and more. So 678 scientists received Parkinson's funding since 2010. And just a little quick side note, I'm not an academic or researcher, but what I know and what we've learned, for folks who are in that track in the academic research medical world, if they get funded to do Alzheimer's research, that's where they're gonna go. We're trying to get these young, bright minds funded so they stick with Parkinson's, because the more they know, the more that's gonna help us. So that's a big part of a lot of our RFPs and requesting proposals for research projects. And then this is really interesting. Our CEO has a background at the Cystic Fibrosis Foundation. And one of the things that he noticed when he was there is that kids with cystic fibrosis in the past had a very short lifespan, very few treatments, if any. But the foundation there worked very hard to develop new drugs and treatments. So right now, once again, not a doctor, what do we have right now to treat Parkinson's? Carbidopa, levodopa, cinnamon, right? There are some variations on that, Rytary, Duopa. We need more options. We need more treatments. And that's what this is all about. So the Parkinson's Virtual Biotech means drug discovery and development. So we want it to take years, not decades, to come up with new drug treatments, strategies, interventions. And we have partnered with Parkinson's UK together, these two international organizations, to do just that. Each organization has earmarked an amount of money, millions of dollars, for this virtual biotech to get testing done so that we can fast track new treatments. We need more than just carbidopa and levodopa. So that's yet another part of what we're doing that probably just isn't as evident to some folks. And then I've got some postcards over here. I'll show you a little bit later. probably everyone here knows that Parkinson's has a genetic component. Am I right? Do you know that? About 15% of everyone diagnosed with Parkinson's, they have specific genes. LRRK2 is usually the one talked about the most, but there are others. And I talked to a lot, I feel like I talked to way more than 50% of the people who say my grandmother had Parkinson's or my uncle. But what about the other big portion of the population of people with Parkinson's without the genetic Parkinson's? That's what PD gene or PD generation is all about. The Parkinson's Foundation launched this research project right before COVID, literally months before COVID, at 7 different medical sites throughout the country. And of course, COVID changed the face of PD generation. But in a kind of silver lining way, it was great because it forced us to rethink how this research project could be conducted. And now, you can be part of this research, you can be part of PD generation from your home. You don't even have to leave your home. It's all been simplified, and it's a cheek swab so that we can figure out what's true. What are the real statistics and dynamics about this? We have over 10,000 people already enrolled in PD generation. We need, I'm not sure how many more. I think the original goal was 15,000. I believe that's going to be raised. So if you're interested, the only requirement is that you have been diagnosed with Parkinson's. And how you enroll is by calling our helpline. So if anyone's interested, happy to tell you more. I do have a postcard right over there, which we can make sure you get before you leave. So I talked about care and like people from Binghamton, Elmira, the northern border of Pennsylvania, either having to travel miles and miles for the Parkinson's care. So the Movement Disorder Clinic at the U of R is one of the Parkinson's Foundation's Centers of Excellence. We have several designations now. So we are trying to shepherd more specific, focused Parkinson's care. And it's not just the United States, it's actually international. We have a Center of Excellence in Australia, in Israel, in Japan, I think it's also Singapore, Italy, UK. We know, once again, that movement disorder specialists are really the top, what you really hopefully can get in terms of your Parkinson's care. But once again, that's not true for everybody. Not everyone has that access. The Centers of Excellence are required to meet certain designated standards besides providing that clinical care. They also need to be conducting research, Parkinson's research, and then they need to have the whole host of clinical services, PT, OT, speech, as well. There's other regulations and stipulations as well. But we have 57 Centers of Excellence so far. We are building on that and want to do more. But the realization is that not every place that has a movement disorder specialist necessarily is conducting research. So, in addition to, and this is referred to as our global care network, delivering care to over 200,000 people, we now have developed comprehensive care center designation. So that now exists for institutions that have great clinical services, the PT, the OT, the movement disorder, but they don't necessarily do the research. Because we were hearing from so many places, you know, we want to be designated, but they didn't do research. So this foundation has created a whole new system for those institutions to be recognized as well. So our global care network is now our Centers of Excellence. The, all these names now I'm trying to keep track of. The Comprehensive Care Centers, the CCCs. And then, last but not least, we have adopted and absorbed a special program that was started at the Struthers Center in Minnesota. Think about rehab centers, we have many assisted living facilities, home care agencies. All of those entities interact with people with Parkinson's, but many of them don't know a thing about Parkinson's, the staff who work with those institutions. So the folks at the Struthers Institute created a really neat program called the Community Partners in Parkinson's Care. That is now part of the Parkinson's Foundation. So we have the real clinical side, the doctors over here, but now we are working to educate and train the other side, the public side, the public-facing side of these places, assisted living, home care, etc. Once again, I could go and regale you with so many different stories and the list of all these places. There's still so much to do, but this is now all part of improving care, that second pillar that I told you about. And I'm guessing by next year there'll probably be yet another part to add to this equation. So important though, because we need people with Parkinson's to get the best care that there is. So you know, no two people are the same who live with Parkinson's, who experience Parkinson's. Okay, does everyone know that we have a helpline? The Parkinson's Foundation helpline? Is that news to anybody? So we've had a helpline, I'm not sure how many years, 20, 25 years maybe, and it has grown over time. We take 26,000 calls annually. It's actually calls and emails because people can not only call, they can email us. Our helpline is there to support anyone who has a question with Parkinson's. We might call the helpline because somebody asked us a question or we're wondering something. Our helpline specialists are amazing. This is part of working directly with people with Parkinson's. And I have helpline cards for you over there, so everyone can have one. Please don't hesitate, that's what it's there for. We specifically want to be able to reach out and be able to provide as much support as possible. And then you see a couple of books, which I brought samples with me over here. I was talking to someone before we started. I would have loved to bring copies of all this for everybody, but I really would have needed a U-Haul. So we have a system, and we get these ordered for you. This is all part of our mission. They're mailed to you free of charge. But if you wanted to access, say the book that says Caring and Coping or Mood, if you wanted to access it right away, like Nancy, it's taking too long, you didn't get this, you know, it's not going to be in the mail to me till next week. You can access any of our resources on Parkinson.org, like your website. It's Parkinson without an S, just .org. So many resources you can access. We have over 75 fact sheets from everything you can imagine: dental health in Parkinson's, driving in Parkinson's, posture in Parkinson's, pain. It goes on and on. 75 different topics of fact sheets. Big assortment of books, medications, very popular book, oftentimes big orders for that. Frequently asked questions. So I'll show you all these in just a minute. These are all available too. This is, once again, the third pillar, part of engaging with and supporting the Parkinson's community with as many resources as possible. And just so you know, you might be interested, if you went to Parkinson.org, I should have thought to pull it up. I'm guessing this computer is connected to the internet. Maybe I'll pull that up before we finish. It's a compendium of information. But if you wanted to just wonder, I wonder if anybody else has had this question, or I have a question I'd just like to ask the online community. If you scroll all the way down on the landing page of Parkinson.org, there's something called PD Conversations. Really simple to join. And you can just go and look at the questions and the answers too. If you have anything you're wondering about, I would encourage you to take a look. It's a great resource in addition to everything going on here. As I mentioned right at the beginning, we know now there's 90,000 new people diagnosed each year. A couple years ago, members from our PPAC, that's our People with Parkinson's Advisory Council, they helped us develop a brand new kit or guide, a newly diagnosed guide, which I have a sample of over here too. It can be so overwhelming. I've had so many people, share that, gosh, I went to the internet and just was so overwhelmed with all the stuff I saw, and not necessarily all legitimate information either. So folks from the PPAC, in addition to some of our staff, put together this newly diagnosed guide, and it's the top 5 things to think about, after So we have those available. Once again, you can access it right online if you wanted to, not wait for the hard copy. And then our hospital safety guide. Does this fanny pack looking thing look familiar to anybody? Okay. The Aware and Care Kit. So this has long been part of the Parkinson's Foundation, a hospital safety advocacy kit with a ton of information inside about medications that are contraindicated, medical alert card, there's a bracelet in there, not sure how sturdy the bracelet was. Things to help somebody get through a hospital. I understand, I've been told, that this is gonna be the topic of your March meeting. And I can't implore you enough how important this is, that you really think about how you can prepare and protect yourself in advance. Sometimes, of course, we don't know we have to go to the hospital, but many times there are planned hospitalizations, be it a hip replacement, knee replacement, any of those things. But over time, this really became the feedback we were getting, people weren't really using the pouch, very expensive to produce. So two things happened as a result of taking a look at the Aware and Care Kit. We now have a new initiative. It's our hospital safety initiative. The Aware and Care Kit is now replaced by this hospital safety guide. It is expanded information. It gives you the top 5 things to think about. It is bigger print than a lot of the things in here. Makes a big difference. And it's something that you can take a look at, peruse at your leisure, but will give you such valuable information. And I'm gonna order enough to have sent for your meeting in March, so there'll be copies available. Should someone need this before then, though, happy to get it for you in advance of your March meeting. But I folded it upside down, sorry. If you need to look at it, happy to have you look at it as well. So the 2 things that I mentioned, the hospital safety guide being one, replacing the Aware and Care Kit. But once again, something that Parkinson's Foundation is doing that might just not be as visible is that we have a whole new initiative working on electronic medical records. Here's the key. If electronic medical records had the programming in there that saw Parkinson's diagnosis, oh, I shouldn't give this antipsychotic because it's counterindicated with many Parkinson's medications, it would red flag the staff so that order couldn't be put through. Or there are systems in place with this electronic medical record in hospitals that prepares staff. I can't imagine what it's like to be, in the ER on floors where you have so many different people, so many different ailments, diagnoses going on. It's no wonder they don't know the particulars, the finer points and nuances of Parkinson's, but we're trying to do our best to make sure that any way as possible that they will know, or that something will trigger that so that they will be alerted and know. Outcomes for people with Parkinson's who go in the hospital, it's not a good statistic. We want to make sure that improves dramatically. And this is one way in which you can actively work towards making sure that any hospitalization has a much better outcome than what we have seen for years and years. If you still have one of these and you want to use it, absolutely, feel free. If it works for you, get both. That's fine too. But this is yet another big initiative that the foundation has taken on. Let's see where we are here. Okay. So, moving in. Amy mentioned that right at the beginning. She's going to talk a little bit more about it. If you want to do it now, or if you want to wait to the end, whichever way.
I can wait till the end.
Okay. It's just a great event. If you ever have the opportunity to be part of Moving Day, it's phenomenal. It is the Parkinson's community coming together. I get goosebumps just thinking about it. I think between Buffalo, Rochester, Syracuse, I have now worked at 15 moving days, I think, in the course of my career. And each one is incredibly special. So I really hope that the work that Amy and her committees do to make moving day happen. I hope you can be involved in that and experience it. The other thing I should say too, and this is really to tell you all about what we do, but just so you know, we do not receive any outside government funding. Everything that I've shared with you, it's because our staff have raised the money. We've gotten great donations, maybe a few foundations. It's all philanthropic. So it's important moving day happens. It's important we're successful in those ways because we want to continue to do more and more. And then health, education, wellness. I have another postcard over here. I just wanted to share with you. You do a great job. You have so much available on Zoom. Anyone ever hear of PD Health at Home? Mindfulness Monday, Wellness Wednesday, Fitness Friday? So that's something that was born out of COVID because people like me, when COVID happened, I couldn't do my job anymore. So with my team, all of us came up with this brand new program. It was so successful. It continues today. Thousands of people tune in to new programming every single week. Oh, I'm sorry, that one was about community grants. Oops, going back. That PD Health at Home. Let me stop for a minute. Another part of our mission is because groups like this, the services that you have here, don't exist in a lot of other places. We have what is called community grants. And in fact, today's the deadline for folks to apply for our next round of community grants. So every year we award $1 million or more when we have that extra surplus to groups, communities throughout the country, provide everything from education programs, a lot of exercise programs, some mental health related programs, and to support people with Parkinson's and their care partners. So that's a big part of our mission as well, in addition to research and the improving care. This is under the third pillar of our community grants. Sorry, I missed that. Wasn't looking directly at my notes. So PD Held at Home, if you want to check it out, really encourage you to. And here's a tip, a pro tip if you would like. Say there is a Wellness Wednesday program next week that you really like the topic of, you really wanted to be there anytime. And then you find out, oh, I've got a doctor's appointment right at that time. I won't even bother. Well, you know what? If you register, even if you can't attend live, you'll get an email in about a week after the program with a link to the recording, just like this is being recorded. Zoom is such a wonderful thing, right? It makes so much possible. We record everything, almost all of our programs, and you can have access to those by simply registering. And you can also just go to we have a YouTube channel, hundreds and hundreds of videos of programs on our YouTube channel. So you could just go to youtube.com and put in the search bar, Parkinson's Foundation, or you can get to it through parkinson.org/YouTube as well. So tons of ways you can access education about Parkinson's. So many different there's so many topics, it's limitless. And so many wonderful expert speakers as well. Okay, I know I'm running out of time here, so let me see. So here's our plea to you to think about getting involved. Whether it's moving day, Parkinson's Champions is something else that we don't have time for. Maybe it is finding another event, local resources. You can also share your story on our website, or I can have somebody talk to you from our team who can share your story. And volunteer, we're trying to do a very big push on volunteers. And you can become a Parkinson's volunteer ambassador if you're interested. Just let us know and we'll tell you all about that. And then, kind of rounding this all out, our impact. Whether it's someone receives care at one of our centers of excellence, hopefully participates in PPG, maybe training from a funded therapist, all other ways you can volunteer as well. But there's to just so many avenues that the Parkinson's Foundation and you can intersect. And once again, I mentioned the philanthropic side. We knew we needed to do more than just kind of our usual annual budget of what we needed to do all of this. So probably last year or the year before, I can't remember, a whole big capital campaign was launched to raise $30 million to fund even more research, expand care, and to grow our community. So if anyone would like information about that, happy to give it to you as well. And I mentioned our helpline. So this is my big plea at the end here. Parkinson.org, I mentioned our website, tremendous resource for you. Our helpline, 1-800-4PD-INFO. There's the numeric version. You can also email the helpline. I just want to run over here quickly. I mentioned all of the books. I have samples here if anybody wants to take a look. I've got the resource order form. And then there are definitely just things that you can take with you. This is just a reminder about PD Health at Home. Here's our helpline card, so you have that number readily available. And one other thing. So when we were more perhaps localized and did education programs, some people might remember symposiums. Does that ring a bell to anybody? So now my job is on a bit bigger scale, excuse me, covering New York and New Jersey. Still do a symposium, 2023. It was in Rochester last March. This year, it will be in Freehold, New Jersey. Now, I'd love it if any of you would like to come to Freehold, New Jersey with me, but I understand that that might not be possible. But it's going to be broadcast live on Zoom. Once again, if you can't watch the whole thing, you're not sure you can watch it all that day, still register because you'll get a link to the recording. So I want to make sure that anyone who is interested, the symposium is still taking place, great speakers lined up, so I'd love if you could participate in that. Amy, I'm going to be quiet for a minute in case you want to say something else before we just do Q&A. Nope. Questions? I know I just talked and talked at you for so long here. It went by so fast.
We can do questions too after we talk about moving day if you want to sit and think about it, and if you have any other questions. No?
What does a moving day look like?
That's what I'm gonna do right now. All right, well, since it's called moving day, and we've all been sitting here for about 40 minutes, why don't we do just a little, like everyone just do a nice stretch for me, because let me tell you, I need to stretch. It's so nice and cozy and warm in here that I just feel like I just need to get my blood moving. So the big thing about moving day is that we're always moving. We have yoga, we have demonstrations of boxing, all sorts of stuff. So the key to Parkinson's, as you know, and as I'm learning more and more about it, is movement. So moving day is a celebration of moving. We have, like I said, we have the Buffalo Walk and the Rochester Walk. Those are taking place in the fall. But what I'm working on right now is the Ithaca Walk, or the Finger Lakes Walk. And I'll tell you about that, and if you're interested, please, I'd love for you to join both walks. It's mainly fundraising for all the programs that Nancy has kindly talked about today. Everything that we provide with the website and all of our staff and the symposiums and things. So I'm here to reach out and ask for your help. So moving day, I'll talk about that first. There is demonstrations from, we actually have the Rocksteady group from Finger Lakes, yes, the Geneva and the Victor group with Robin. We also have Speak Out, so we do a voice demonstration, and then this year we might be doing a Tai Chi. I'm not sure what we're going to be doing yet. So it's very exciting just to have those examples. We have several Rocksteadies in town that come, and you can talk to them and talk about the ones that you're with right now, which is fantastic if you're with the Victor one. Are you with the Victor one or the 360 one? The Victor? Yeah. So Robin does a fantastic job over there. She's a personal friend of mine, so I love that, you know, we get to work together in this aspect as well. So moving day, you show up in the morning. Here's the Rochester one. Thank you so much.
Where is it in Rochester?
So let me get to Finger Lakes first. So
Okay.
Finger Lakes is gonna be in, Saturday, May 18th. It used to be in Rochester on a Sunday, but this year it's going to be on a Saturday. Last year in Rochester, it was an innovative field, but in the past it was at Monroe Community College, and we are going back to Monroe Community College this year. So that is gonna be fantastic because we're just gonna have, it's just a little bit more spread out. The walk is just a little bit prettier. We got to walk around the stadium in Rochester, but with the one at MCC, we're gonna have the students involved. Hopefully we'll have the caterers involved, and we'll get little snacks and coffee. And it's just more of a celebration for all the things, and bringing everyone together to talk about the resources. Where we might have a real estate agent there talking about, real estate and phone company and, resources with canes and things like that. So there's a lot of fun resources there besides the rock study, without the speak outs and things like that. So it's more of a day to celebrate and find other resources for other activities that you do. It's not just the walk, and that's what we want to remind everyone. The walk is fantastic. You get out with your group, you get to, if you have a team, it's fun. You can do, I have a prize for the best t-shirt. So if your team has, you can do t-shirts for your team. Someone, for the Rochester one, they showed up in tutus last year, blue tutus, and it was really cute, and they won because they had t-shirts and tutus and socks and fun things, and it's just a celebration of the day. Bring your family, bring your friends. For the Rochester one, we also do a raffle, silent auction type, and all that money that we raise from donations that we receive get picked up that day, and you guys auction it off and put donations in and buy raffle tickets. So that's another fun aspect to it. We have a cheer team that cheers you on as you're walking through and just keeps you going. We had Cornell students, doctorate students, cheering us on, and we have lots of volunteers. So with the form that I sent you, or that I've given you, and I'll keep talking about it, but with the form, it says on the bottom here, if you'd like to volunteer the day of for moving day, or if you'd like to be on my committee and help me plan this huge event. We meet once a month on the committee, and the volunteers, you can volunteer that day. And you can go on the website.
Oh, sorry, I took it down, but
Oh, that's
bring it
okay.
back up.
On the website, it'll say, you click on the link, and it'll tell you exactly for the volunteer forms. The one that she has up right now, or that she will put up, Nancy will have up, is for the past Rochester one, and it's already happened. So when you go down to, can you go down to where the volunteer, there's a volunteer right there. So you click on that, and you fill out a form, and there's different jobs that you can do the day of. You can help with the day before, and you can help with the day of, and then you can still participate in the walk. And I love volunteers, and I love having everyone, you get a t-shirt, you come and you help out, and it's a lot of fun just being around everyone. The actual moving day, what that pertains is we start fundraising for that probably 6 months before the walk happens. So the Rochester website, this is for last year. So we were trying to raise $120,000, and we got up to $118. We're so close. And we're still accepting donations for the Rochester one right now still. And then this closes out in another month or so. And then we'll get the whole fresh new website, and we'll start again and try to raise money again for the following year. If you raise $100, you receive a t-shirt. Yeah, this is our honor roll. These are our teams. These are our participants. These are the different teams we have. You can join a team if you see a team up here that you'd like to join, or if you want to start your own team. And there's a team captain, and we go through, we recruit people, or if you just want to be an individual that comes for the day and you want to raise money any way that you want. With these teams and with these groups, you can do a Facebook fundraiser. And if you're involved, or your grandkids, or anyone's involved on Facebook, they can easily do it. We have a very step-by-step form that can show you exactly how to do it. Or you can always call me and I can walk you through it, either way. And that's why I sent these forms up, so if you want to go to Rochester or Finger Lakes, I can fill this out for you. And once the website goes live, I will email you all the information about participating, so that you don't have to register online. I will do it all for you. And then you'll start getting emails and information about the day of. And what we're looking for when we're fundraising, you can either collect checks, they can mail them in, but let me tell you, $5, $10, $20, every dollar counts. Nothing is too small to take a donation. Now, what a lot of people do is they take their cans and they collect the cans for so many months, and they take the, 5 cents for each can, or 10 cents, whatever it is, and then they take that donation, and that's their donation towards the group. If you don't feel comfortable asking your friends or family for money, do a garage sale. There's so many other ways to raise money, and it's more about the awareness. So if you're on social media and you post anything about the day of, or bring people for the day of, it's a celebration. That's the key. If you raise $100, you get a blue t-shirt. It's a different t-shirt, and I'll hold it up in a second. For $250 you raise, you get a mug and a t-shirt. If you raise $500, you get an umbrella, a mug, and a t-shirt. And if you raise $1,000, it's a really nice zip-up sweatshirt, an umbrella, a mug, and a t-shirt. So it's really a nice color blue t-shirt this year. It's normally this color blue, but this color blue here. But it's more of a periwinkle this year. So I'm very excited that we've actually got a new color, and it says, "We care, we fight, we move." So it's a really fun t-shirt, and the fact that you can wear that t-shirt year-round is you're advertising for Parkinson's and Moving Day and bringing awareness to people. During the Moving Day, we do a quick conversation, and a speaker comes up. We actually, for the Rochester one, we have Rebecca LeClaire. Does anyone know who Rebecca is? She was a Channel 10 broadcaster, and funny story is that I used to run her camera back in the day when I worked at Channel 10. So we got to reunite together and talk about the good old days working at TV. But she is our MC, and she will talk about stories with a person with PD. So if you'd like to be honored and talk, or you write in, it's like, I don't know, a couple paragraphs about yourself, just someone with PD, Parkinson's disease, a caretaker, a person who works with Parkinson's disease, and then someone who wants to beat Parkinson's. So we just have a quick story about that, very positive, very happy, and then we go and we do the walk. The walk is about a mile, depending on which area we go to, but in Rochester it's about a mile, and then we have even a shorter one, that if you don't want to do the whole mile. And then you come back and you talk with all the other resources, and you pick up your prizes, and it's a nice celebration. We also have a marching band, and it's a lot of fun because they're playing the whole time, and it's really great. So I hope that all of you will consider helping out with Moving Day, volunteer. If you want to fill those forms out and get them to me today, or if you want to fill them out and hand them, and I can always contact you guys about picking it up another time. So, and that's what. Any questions about Moving Day?
You didn't give this row forms.
Oh, I'm so sorry. Would you like the?
I don't know anybody else.
This is the Finger Lakes one, and then this is a form to fill out.
Thank you.
And you can put 2 names on it if you'd like. Any other questions? Just put his name on it. That's fine. Did you want me? Yeah, and just get a team, and it's a lot of fun because we do prizes for teams. Did you go ahead? No, Finger Lakes is going to be at Ithaca. It's going to be at Stewart Park in Ithaca, and that is going to be May 18th. MCC is going to be a Saturday, the last Saturday in September. So I think that's the 28th. So, and like I said, the website has not opened yet. We're going to close out. I'm kind of ahead of myself. I like getting things done ahead of time. So I've already even got some sponsors, and if you know anyone who would like to sponsor a business or anything like that, we definitely have sponsorship packages. And on that t-shirt that I was showing you, our sponsors can, different levels can be on the back of the t-shirts as well. So it's a lot of fun, a lot of energy, and I hope that I can see you each there. Any other questions? Has anyone been to Moving Day? Anyone plan on attending Moving Day? Hopefully this whole room, come on, it's a lot of fun. So I'm excited for you guys to see. There's a lot of information on the website for Moving Day, and I'll come again and see if anyone needs help getting signed up for the Rochester one. So thank you so much.
Thank you so much, and I'll be over here if anybody has questions about the resources.
And the food is over there. Thank you.
Thanks, everybody. Thanks.